So when somebody comes in and you cannot save their teeth, what are their options when it comes to dental implants? And the people that are already denture wearers, what are their options with dental implants?
So your first option is to just put 2 implants in the bottom, and it's going to secure the lower denture, and it snaps into that. It'll allow you to chew more foods. We can shorten the acrylic a little bit, and it'll still be very secure, so it's a little more comfortable. And it's going to be it's going to still have some maintenance issues because it's just got 2, so it makes it a lot more secure, but there's a little bit in the back. It can still move a little bit, but it's a good option. We've got another option where if we had 2 more implants, so that's just 4, you get this kind of table formation, so it's very secure. That one does a great job at keeping your bones stable over the years, and with that you can chew anything. Like you can chew through a door if you had to. And that's going to be our best option. That's like having your teeth again.
So they don't come in and out?
They don't come in and out, yeah. We kind of screw them into place, and that's it for life. There's different types of bridge material that we can put on the top of it, and if we go with the zirconia option, like that's going to last a lifetime.
All right. And now you do these, not, I guess these are titanium implants, but you do more of a holistic option. What is that?
Yeah, they're the metal-free or the zirconia implants. So they're white and they're holistic. They're more like a ceramic than they are a metal. Very, very strong. They're beautiful. Some people today are worried about having metal in their bodies. There's studies going this way or that, but if you've had metal allergies or problem before, these are going to be best for you. Or if you have a single tooth that you need, if you need a tooth in the front, these are great because they blend in perfectly with the other teeth. If for some reason you got some recession over time, you're not going to get that little gray metal line there. Okay. It just looks white like a tooth root.
Now, what about the upper? So the upper denture wear, aren't they fine because of the suction from the upper?
They're better than the lowers, but they still, it has that palate that covers the roof of your mouth, so you can't taste all the foods that you should, and they come out sometimes, and it's generally, the other thing is you're losing bone every year, and so eventually it's going to get to the point, especially as we get in our 60s, 70s, and 80s, they're going to get to the point where they're fitting less, and then it may be getting kind of late to think about doing some of the implant options.
So on the upper, what are the dental implant options?
So on the upper, it's similar to the lower. You can't do just 2. The bone's a little softer up there, so you have to do minimum of 4. And again, with just 4 implants usually, sometimes we have to add 2 more. We can again do a bridge up there, and that's a permanent option. And then the 2 types of material we make the bridge out of. We can do the kind of regular hybrid type, and that's a great one, lasts 5-10 years. We've got the new zirconia option. On the upper, we have options for materials too. We have the hybrid, which is basically like a very strong acrylic, and that'll look good and last 5+ years depending on what you're eating. Okay. And then we have this the zirconia. And it's extremely strong. It's like cubic zirconia. They call it the white diamond. And
do the teeth look real?
They look phenomenal. Well, it depends on the artist. Some people, it's a material. Like if you use paint and you're not a good artist, it's not going to look good. We have our own lab there, and we take a lot of pride in making these things look natural and beautiful. We want it to be healthy. We want it to look. We don't want to look fake and too white. We just want it to we want it to pop and for people to
no
look.
more dentures?
Yeah. No
because you kind of don't like dentures. You think and I don't want to put words in your mouth, but you think everybody should have dentures that are locked in, secured to something.
I think if you were missing your arm and you just got like a wood post, that's kind of like what a denture is. I think that this is like having your teeth again. In many ways, it's better. Like these things are stronger. They're not going to give you any problems. There's no nerves in it, so it can't hurt, and you can chew through a doorknob. And they're much stronger than natural teeth.